I'm Dr. Bart Rademaker, and this is the Doctor's Guide podcast, bringing to you the insights that you're going to want to have so you can better navigate the challenging health situations that you might come across, or maybe somebody in your own family. Because here's the thing, we don't exactly get this handbook as to how to optimize our health unless, you're one of those people that you're a research nut and you're looking into this every single day. But even myself, there's so much I don't know, and that I actually have to reach out to my colleagues out there or even the internet to figure out some things. But when you do reach out to the internet, you don't even get all the answers that you need to get. And even if you do use Chat GPT, which is quite a mind-boggling concept that we have these days, and a little frightening at times, but then again, maybe very useful. But here's the truth. You want to reach out to those amazing human beings like Rob and Ben, both doctors in palliative care. And they'll explain to you what that is exactly, because I'll mess it up, I'm sure. But here's the thing. You reach out to them to understand how to navigate this difficult process that they're going to share with you today. And this is the purpose of this podcast, to enlighten you with new insights and action steps in all areas of health optimization for yourself or for others that you haven't quite figured out how to do. So it's not selling a product, or it's not selling a person, it's selling a process of how we make decisions. And so how do we do that? Well, we're going to do it through role playing. New concept on this podcast, theme here, because most of the time we're just talking about stuff and it's kind of, boring at times. But you can relate to these two guys, the two brilliant human beings that I've just got to meet. And I'm honored to have them on my show today. And so I'm going to start off with them introducing themselves, then what role playing they're going to be doing. And then we'll jump into about 6 minutes of role playing, and then we're going to unpack it afterwards so that you leave this 25-minute podcast with some clear insights and action steps that you can take either for yourself or for someone else. And I just have to say, we just did one just right before this show, and I had tears in my eyes. So I'm waiting to have that same effect once again. Now, Ben, thank you so much for joining us today. Tell us a little bit about you. Then Rob, and then after that, we're going to go into the role play. So Ben, thank you for joining me today.
Cool. Thank you, Bart, for having me. Honor to be here. I'm Ben Thompson. I am a palliative medicine doctor, division chief of hospice and palliative medicine for Presbyterian Health in Columbia, South Carolina. And I'm thrilled to be here with Rob, who's one of my mentors.
Sweet. Dr. Rob.
Yes, hi there. I'm Rab Razzak. I'm a palliative medicine doc and internist out in Cleveland, Ohio. I'm a coaster, both East and West Coast, but mostly East Coast. But I'm currently in Cleveland, Ohio. I've had the privilege of doing a lot of teaching, a lot of mentorship, being mentored by some amazing people. And I want to be able to pass that down to all my colleagues and friends.
Well, both of you guys are extremely humble, because I know there's a lot more to both of you. You both are giants in your own field. But more importantly, the humanity that you bring to this world is just outstanding. And I really appreciate that from both of you. And so I'm honored that you're here on this podcast. But just explain briefly what is palliative care and versus hospice, because I think a lot of people get that confused.
Ben?
Sure. So palliative care is a field of medicine that's appropriate for any patient and their family who's experiencing a life-limiting illness, whether it is heart failure or dementia or cancer that's spread at any point in that life-limiting illness. So it's not just a bunch of doctors that do palliative care, but our superpower is the interdisciplinary team that's comprised of nurses, chaplains, social workers, physical and occupational therapists, speech therapists, music therapists, child life specialists. I could go on and on about all the members of our team, but we really provide comprehensive support for the patient and their family and walk with them through their journey of serious illness. Hospice is different than palliative care in that it's a Medicare benefit that was designed for patients who have a life expectancy of 6 months or less if the disease progresses according to its natural course. So that can provide in-home care, it can provide inpatient hospice care for folks who have a very short time to live. But it's different. Our training is in hospice and palliative care together, but Rob and I are both palliative care doctors.
Yeah, it's a whole
And
different. Go ahead, Rob.
and I just want to add in, it turns out a lot of the data shows that when palliative care is involved, people live better and longer with it than without it. And the same holds true for hospice for people who are at the end of their lives.
Yeah, so it's a really important element. And for any of those listeners out there who are experiencing a family member at this time, it's really good to listen to these two gentlemen and learn from this. And I know we're role playing, and so, but it's real stuff, it's real life, and I want you to tap into their humanity, their empathy, because it's pretty incredible. All right, Ben, what's your role today?
I'm going to be an internist who is dealing with a family that's causing me some significant emotional distress. And I'm going to ask Rob, a palliative care consultant at my hospital, for some help with managing the care of this patient and their family.
Great. All right, go
And
for it.
I guess if you're going to do that, I will be focused a lot of my attention on you, because as a palliative care physician or even a provider, my goal is not only take care of our patients and their families, but also take care of our care teams.
All right, go for it.
Hey, Rob, do you have a second? I'd love to pick your brain about something.
Sure, Ben. Dude, you look exhausted. What's going on?
And it's this case. I've been working with this patient for the last couple weeks, and it's he just reminds me so much of my dad.
Mm.
And a couple years ago, when my dad was dealing with heart failure and he was going through this journey, I see him in the hospital bed when I'm talking to this guy. I mean, he likes the same movies. He and his wife have the same quibbles that my parents have, and I just feel so close to it, and I want to do the best job I can for them. But every time that he says he wouldn't want CPR or he wouldn't want advanced therapies, I just I feel like I can't approve of that. I feel like I need to hold on to him.
Wow, wow, that's so hard. I mean, seeing your family through your patients, I can, that's so tough.
Yeah, I mean, I know we learn about like transference and countertransference, and like I know all of these things exist, but I don't know what to do, and
Mhm.
I don't know if I'm really providing them the best care anymore.
Oh, wow, wow. So maybe we can start. You have time right now to talk about some
Yeah,
of this stuff,
yeah, if you
or
do, I
is
mean,
it a?
yeah, that'd
Oh,
be
yeah,
really
sure.
helpful.
I'm happy to make some time. So how are you? How have you been coping with this?
Um, well, I'm doing my normal stuff. I'm spending time with my family. I posted about it in the Hospice and Palliative Medicine Self-Care Forum, and got some really good advice from some folks.
Mm.
I wanted to talk to you about it,
Sure,
um,
sure.
but no, I don't know.
And so first, a couple things about your dad. What are some things that you remember about your dad that bring a smile to your face?
Um, he used to play the Temptations Psychedelic Shack album just on
Okay,
repeat,
okay.
and just loved it, from the knock at the door and the creak that opens the album all the way through the end. I just remember even being a young man and shooting pool in our basement, listening to that album with him. It's kind of a part of our history.
Oh, wow.
Uh, he taught me how to throw a frisbee, and that's always been a big thing for me. And a
Hmm.
very active guy.
Yeah.
So yeah.
And what else did you appreciate about your dad? When you think about your dad, what do you think about?
Man, just his love of adventure. You know, he's active, he's outgoing. He always had a plan for some adventure we could go on, something we could get into, whether it's driving 4 hours to the beach or, you know, driving an hour to a cornfield or just walking around our neighborhood looking for something on a treasure map that he made.
Mm-hmm. Sounds like you had some wonderful memories with him.
I really did. I really did before he got sick.
Yeah. And so if you could be here right now, what would be some of the things you'd want to say to him?
Well, I mean, he may tell me that it's not about me. He may tell me it's about the patient.
Hmm.
And we have this joke that's way too explicit for me to tell you right now, but it involved waving his hands in the air and saying, "Get over it," with some expletives afterwards. And so he'd probably say something like that, like, "Listen, it's not me. Quit. You know, stop whining and just do your job. Just be
Mhm.
there for this guy because he needs you, like I would have needed you."
Okay. All right. And so as you think about these experiences with this patient and family, what are some things you do to sort of take time for yourself? You mentioned you spent some time with your family. You've been
Yeah.
posting on the HPM site.
Yeah.
What are some immediate things that you do to sort of help you cope with what's happening?
Well, we have a really good employee assistance program, sort of
Mhm.
like a self-care check-in with staff psychologists in my hospital. I haven't called them yet for this case because it's so fresh,
Yeah.
but typically I'd reach out to them.
Okay.
Um, and you know, I like to go for runs and just spend time talking to my wife about the hard cases.
Okay. And where have you been able to do that for this patient or no?
You know, it's kind of been a mess of things recently. My wife's been traveling, the weather's been bad. I've had to watch the kids, so I couldn't run, and I had to
Okay.
get home, so I couldn't go to the employee assistance program. So I've just kind of all my normal coping mechanisms have just been cut off at the knees.
Okay, we
Okay.
have half a minute left, guys.
Okay. And so, and what time do the kids wake up?
Like 7,
Okay. And what time do you wake up?
like 5.
Okay. Wow, you've got 2 hours.
Yeah, I
Yeah.
guess you're right. So maybe I could do something with that time. Maybe not outside, but maybe I'll find a friend that's awake at that time that I could call or see if Psychology Today could direct me to someone maybe that
Okay.
could meet me at that time.
Sounds great.
Awesome, guys. Thank you so much. Ben, what was that for you, and where were you coming from?
Um, During the last break that we had where we were debriefing from our first case, we were talking about the emotional burden of the work that we do. Uh, our field of palliative medicine, we saw a lot of burnout during the pandemic when the workloads increased to a point that was almost unsustainable, where you had doctors who were getting emergency certified in certain states that they could provide telemedicine in New York for COVID for patients with COVID. So I think just recognizing how much emotional fatigue can occur in our field and what the boundary of healthy emotional attachment and unhealthy, pathologic, or destructive emotional experiences can be. I think it's something important to highlight. So just grateful for the opportunity to do so.
Rob?
Yeah, I mean, I think as Ben was talking about his patient and the memory of his dad, I wanted to be able to sort of connect it at the same time, sort of bring back his dad to the picture to uh, for the positive memories to come back, right? So he gets some of that, and at the same time help him find tools for to be able to process, um, or some helpful tools that he usually goes to be able to process.
Um, uh, did you want to say something, Ben?
Yeah, Bart, I did. That I don't know if anyone listening or playing along with this role play. I would say for most people, myself included, it doesn't feel like the natural thing to do to say, "Hey, I'm having problems because this patient reminds me of my dad." And Rob's response is, "Well, tell me about your dad." Right? You know, it would be a lot easier to deflect and say, "Oh, that sounds terrible. How are you coping?" Right? But Rob took that such a helpful and, you know, evidence-based and specialist level step to bring the memory of my dad back into the vignette to help me process it. But I don't know if anyone felt that during the time that Rob was speaking, but it's not, at least for me, that's not the natural direction that I would take that conversation. But I think it's so helpful. And
So that was unexpected for you.
well, I know Rob, and I know he's a very good palliative care doctor, so nothing surprises me when it comes
Okay.
to him.
I just want to commend both of you. Well, I'm gonna did you want to say something, Rob, before I
I
give
just
my
have one last comment. I mean, I think as we have these interactions with either patients, their families, or a lot of our colleagues, is the Brene Brown saying, being curious. Um, and so I think curiosity is something that has really helped me both in my career and my personal life. And it's something that I sort of want to be able to carry on and help people recall and remember.
Well, I really, from the deepest part of my heart, want to commend both of you for what you shared with us today. It's very real, and it's a part that I think a lot of people don't even recognize or realize is actually happening. And what you both did is quite remarkable. First of all, Ben, choosing to reach out, but choosing to have the awareness of what's really going in, and so that people also recognize it's a tough job. It is a really incredibly tough job to do what it is that you do. In fact, for most MDs, by the way, to do what you do, and then at the same time hold this mask of complete empowerment, so that you don't freak out the family or the patients. I mean, it's if there's a tremendous duality here, and sometimes it's I think some docs may have a hard time understanding those nuances, and then either go too far one way or another. And so what you've done, I mean, you've embodied the absolute best in the humanity of physicians, in my opinion, by being vulnerable on the one hand, by recognizing where you're at, go reaching out for help, because what you're no more or less human than anybody else, and you have the same things going on, except for one thing: you've chosen to take this incredible task to help others where most people would just run away. And then you, Rob, that was beautiful what you did there. And I love the fact how you were able to beautifully pivot the focus of where he was at, and rather than telling him what to do, you got him out through this, the questioning, the curiosity, in such a beautiful way. And you could feel it, you could see it and feel it and hear it. And Ben, how he was actually relating to his dad. That was such a beautiful thing. And so again, the reason for this role playing is for people then to not just hear it, but actually be part of the experience of real life. And some people may say, well, this is ridiculous, this is silly, why are you doing this, you're triggering me. No, this is part of helping people see what's real. It's not fabricated. These two gentlemen are so incredibly real, so incredibly beautiful and vulnerable at the same time. I'm going to leave you a few more minutes to share anything you want to share, before we wrap it up? We have about 5 minutes left.
Yeah, I mean, so I want to reiterate what Ben is saying, and it's not just palliative care doctors. Our nursing staff, they are burned out. Like many have left the field, right? There's a shortage of nurses, shortage of doctors, shortage of like respiratory therapists, you name it. And so we need to figure out ways to be able to care for ourselves and our colleagues so that we don't leave and do it in real time and in ways that are helpful and not harmful. They don't need some more pizza, you know.
Ben?
Yeah. The problem of burnout is not solved by another pizza party. Absolutely. I think what you said, the most important thing, Bart, is knowing when it's important to reach out, knowing when you're at a point where maybe you're not being as effective as you need to be for your patients, right? We've taken an oath as doctors to do no harm, but if there's something that's compromising our clinical judgment, whether it's alcohol or drugs, whether it's some other type of addiction, whether it's something personal, whether it's something about the patient, and you're not providing them the best care possible, you need to reflect and say, what can I do to take better care of these patients?
No,
And
I
having a palliative care team, having doctors like Rob that you can call and say, hey, Rob, having a hard time, help me, walk me through this is vital.
and I think that goes for everyone, is first of all taking ownership, and it begins with awareness. And then, as Rob was saying, having the curiosity rather than judgment. And then, figure out, what's going on here. And letting the other person share. I mean, and you did that so nicely, Rob, without leading questions, right? Which is an open-ended question. So like, what's going on? What did you like to do with your dad? That kind of stuff. And it allows people to settle in what's really going on, because you're both all right. There's tremendous amount of burnout, PTSD, doctors are leaving. I think the statistics show that by 2030, we'll be short of 100,000 doctors, and people are only getting sicker and sicker and sicker. And so it's a matter of us getting ownership. I know our time is short, so I want to start off with you, Ben. How do people find you? And one final comment or statement that you'd like to make.
If you're a medical trainee, one thing you'll hear me say is an old newspaper or journalistic idiom is, what was the name of the dog? Right? It's that curiosity. Oh, I love walking my dog every day. Don't leave it there. Find out the name of the dog. Find out where you like to walk the dog, right? Get that type of curiosity. You can find me on Twitter at Ben W. Thompson. I also run a free online virtual didactics called Hospice and Palliative Care Virtual Didactics, which you can find at hapcvirtualdidactics.com.
Thank you. Dr. Rab?
Yes, Rab Razzak. You can find me on Rab Razzak. That is on Twitter at RabRazzak. And the big takeaway is think about how you want to be cared for, and just focus on being curious, being inquisitive, and non-judgment. I think those are, and having true presence where you're not just looking on your watch or looking at your phone while you're communicating, to really be present.
So I want to thank you both. You're showing the humanity that you have, that I think oftentimes patients and families don't quite recognize, and recognize that you have, serious responsibilities. You have to show up in a certain way. You have to exude confidence, but behind that is this beautiful humanity. And I would say, most, if not all, docs have that. And unfortunately, patients don't always get to see that part, and they're judgmental, but it's all understandable because it's really tough situations. And so I like to wrap it up by saying, my name is Dr. Bart Rademaker. I've been on this mission. I'm very passionate about helping people get access to health optimization, making it easy, making it available, making it affordable. And it's all about understanding that processes and ownership as to how you can optimize your health. And so be ready for a lot of really cool things. And this is real life. And these are real problems. And I don't want to suggest anything except for this, that there are many options out there. There are many solutions out there. It's a matter of finding them. And if I can help you get access to incredible people like Rob and Ben, so that you can optimize your health with all the amazing solutions out there, as I curate them, educate you, and guide you, including my doctor colleagues out there, then that's a win for me, even if it's just one person. And if we all did that, if we all took care of one person that way, then our health in this country would be so much better. Because right now, I would say we're spending $4 trillion a year on a 90% on chronic illness, and 50% of our population is chronically ill. We got to change that. And so I know with your help, we will. Thank you, and we'll be back.